So next speaker is Julien Haroche from Hôpital Pitié-Salpêtrière. He has a long walk from the back of the room, and he's going to talk to us today about BCL-2 Immunohistochemistry expression in patients with histio. Thanks, Julien.
Thank you. To select the abstract, so I speak under Tom Abrassa, who is a resident in Brussels, and he spent 6 months in our department last year, and he worked on BCL-2 immunochemistry among histiocytosis. So I'm not a specialist of BCL-2. So BCL-2 belongs to a family of the BCL-2 proteins which play a key role in apoptosis. And you have here the three big class of protein, the BH3 pro-apoptotic only protein, the pro-cell survival proteins, and the apoptosis effector proteins. And normally you have the pro-survival proteins which inhibit the apoptosis effector protein, and then which originate, there is an inhibition here. And if you have stimuli with transcriptional and post-transcriptional stimuli or process, then you will have the inhibition of this apoptotic effector protein and generate a cascade activation and apoptosis. And when you have BCL-2 overexpression, which can be due to chromosomal rearrangement in the case of follicular lymphoma, or as I will develop, epigenetic modifications such as CLL, then you have the increase of the BCL-2 protein, and then you're going to cut this and you will stop apoptosis. So this is something really interesting, and you know obviously the importance of the MAP kinase pathway in histiocytosis throughout all kinds of histiocytosis actually. And so this is the work of Oshrat's team. She was looking for epigenetic modification, and she was able to find that there was an hypermethylated mirlet7 BHG, which was mainly important in case when you got the methylation of certain regions, and this would originate a reduction of the LET-set microRNA expression. And you can find here that's a healthy control, and you can find that there was really a down-regulation of this microRNA, especially in Erdheim-Chester disease patient. And so when you have this, when you have expression of the LET-set B microRNA, then you have anti-apoptotic BCL-2 XL gene expression. And you have, in the contrary, when you have a reduction of this microRNA, the LET-set B microRNA expression, you have an increase of the anti-apoptotic BCL-2 XL gene expression. And there is an homology between BCL-2 XL and BCL-2. And so 100% of patients expressed BCL-2 XL, and 52% you could identify BCL-2 expression. And what is interesting is that when you give a BCL-2 inhibitor, such as venetoclax or a BCL-2 XL inhibitor, you get an increased level of apoptosis. So the purpose of our study, which was it was mainly an immunohistochemistry study, was to investigate the expression of BCL-2 protein among patients diagnosed with histiocytosis. We had ECD, LCH, and malignant histiocytosis, and also Rosai-Dorfman, and to look if we could find a correlation between clinical phenotype and molecular status of these patients. So we did a complementary BCL-2 immunostaining among stained slides of patient. It was a retrospective data. The cutoff we used was, we said it was BCL-2 was positive if it was present in more than half the patients. And so there was two pathologists who were involved in this study, and then we did some statistics to look for to correlate BCL-2 and various clinical or morphological aspect of the disease. So we had 78 patients. 35 were ECD, 24 were malignant histiocytosis. We had 13 Rosai-Dorfman and only 6 LCH. You can see that all Rosai-Dorfman were positive, and about half of the malignant histiocytosis and close to 2/3 of Erdheim-Chester disease. So this is only for ECD, and you can see that if you look at BCL-2+, which was only 20 patients versus BCL-2 negative, which were 15, and if you do univariate, you don't find anything, no difference between the two groups. And for MH, malignant histiocytosis, the only thing which we found was just as close to the only interesting fact was for the male sex, but it's rather poor in terms of statistic. So the limitations of our study is probably the impact of the BCL-2 isoform. Is it BCL-2 or BCL-2 XL? And also the fact that we had not that many patients with targeted therapy. This is a small number of patients, and also there is a subjective BCL-2 immunohistochemistry expression evaluation. So this is only 2 pathologists, and sometimes it's complicated to conclude. So to wrap up, half of patients with malignant histiocytosis and ECD cases, they express BCL-2. The only important message is like 100% of Rosai-Dorfman are BCL-2 positive. No association, in particular for ECD, could be identified either with molecular or clinical features. It would be interesting to study a larger cohort and try to correlate BCL-2 expression. And that's what we're trying to do right now. We are going to include about 30 more patients with ECD taken from the LOVE study back from 7-8 years ago. We have the slides, and what is interesting is we can also correlate BCL-2 expression and the patients that relapse after discontinuing BRAF inhibitor among the BRAF positive patients. And so it would definitely be interesting to treat patients with BCL-2 inhibitor or BCL-XL inhibitor, either as monotherapy in case of BRAF or MEK inhibitors intolerance, or even more interesting, there are some preclinical studies showing that it's interesting to give venetoclax, for instance, with a BRAF inhibitor, especially in mouse. And so that's it. Thank you.